Good evening and welcome to The Square. Tonight is a very timely and important discussion. It's a sixth-part edition of a conversation on mental health that we're having on The Square. This is something that that is very close to The Square's resident panelist thoughts when it comes to mental health. And like I said, it's a sixth edition of mental health, a discussion on mental health. And tonight we're going to focus on, amongst other things, primarily on suicide prevention and awareness, as well as substance abuse. These are issues that are growingly becoming a concern in the country, especially amongst youth. And with us, we have guests with us to share with us not only their testimony, but also their professional opinion on this matter and how we can move forward as a country when it comes to these issues. Joining us, I'd like to welcome with us Chantal Mudahogora, who is a registered clinical counselor. Chantal Mudahogora, great to have you on The Square.
Thank you, Diana. It's a pleasure.
Great. Also joining us is Dennis Akandwanaho, who is the program director at Teen Challenge Rwanda. Dennis, great to have you on the show.
Thank you. The pleasure is all mine. Welcome, our dear viewers.
Thank you, Dennis. My name is Diana Mpisi, host of The Square. As always, I'm joined by The Square resident panelist. I'll start by introducing a resident panelist who's not been here for a while. Very happy to have him back. Charles Habba, great to have you on The Square.
Missed you guys. How are you?
Good. We missed you.
Same here.
Also joining us, resident Square panelist is Bernard Namata. Bernard, great to have you on the show.
Thank you. So nice to see you.
We did miss you, Charles. Yes. Like we always do, we have midweek highlights very quickly. Midweek highlights from The Square resident panelists, things that they've caught their attention that they'd like to share with the viewers. Brenna, is there something you'd like to share with us, if anything?
Yes, the vaccination that is going on. Thanks to everyone who is working so hard. There are so many teams, I think, that are working around the clock to vaccinate everyone. And we must not forget there's still a shortage of vaccines. So what we're seeing right now is out of a lot of effort behind the scenes. And I hope we'll all continue to take caution even as we get vaccinated.
Absolutely. Charles, any midweek highlights?
Yeah, particularly perturbed by end of last week's events around, I'd say, neo-colonial tendencies of where a pseudo-lawyer from Belgium thinks he can just walk into our courts of law and throw his weight around.
Absolutely.
Yeah, I think some of these guys need to be really put in their place.
Absolutely.
Yes.
He was put in his place.
He was put in his place. Absolutely.
And it wasn't enough.
Oh, you think more should have been done?
Yes.
Yeah.
Definitely.
I'm glad anyway that, and I really hope this message, not only from Rwanda, sends a message across African countries that such tendencies are unacceptable in this time and day. I wonder how it would be if the reverse was, if a lawyer went and practiced from Rwanda all the way in Brussels.
You probably not even make it past the airport.
Thank you.
Exactly.
Yeah. But I think the bigger story really on that one,
on terrorism charges,
was that there's probably so many African countries that would not find a problem with that at all.
Yeah.
There's probably quite a number of judges out there who would be like, we are extremely privileged that we have a Belgian lawyer in our midst. Yes. So
and also the fact that usually when Africans travel outside the continent, so there's the passenger manifest that arrives ahead of you, and then just before you get out of the plane, most of the time you must have your documentation ready.
Yes.
Where is your visa? Where are you going to sleep? What are you going to do? And you have to go through this sometimes even before you've actually gone to immigration. Yeah. So
it's just rightly. A gesture that was, it definitely deserved to be put forward. So I'll just go back to our guests, Chantal and Dennis. Thank you for joining us. It's a very important conversation that we want to have tonight on mental health. We want to look at, like I said earlier on, suicide prevention as well as awareness, and very importantly, substance abuse. So I want to start with the first part of the conversation, which is on suicide prevention and awareness. As we're having this conversation, memories are still very fresh in Rwanda, especially in Kigali, of some two gentlemen who, there were two cases of suicide cases that took place just very recently at a multi-storied building located in Nyabugogo. Of course, some of these issues are exacerbated by the COVID-19 pandemic, but the numbers are also extremely alarming. To you, Chantal and Dennis, the Rwanda Investigative Bureau just recently reported in an interview with the media last week that there was a total of 576 suicide cases between July 2019 and June 2020. 576 cases, and this basically tells us that there really is a problem. So my question to you is, and I'll start with you, Chantal, as a society, what better can we do to address these numbers, especially when it comes to suicide prevention and awareness, taking in your background as a registered clinical counselor?
Thank you, Diana. There's a lot of things we can do, actually. As you said, the suicide can be prevented. Usually we do see warning signs before someone decides to take their lives. There are always warning signs. However, though, those warning signs, usually they don't come openly to say, okay, I'm ready to take my life. You have to kind of dig in, because most of the time they will verbalize it in different ways. Also, I should mention that the reason why suicide can be prevented is that suicide itself, or substance use disorders, they are tip of icebergs. They are consequences, they are not causes. So the causes are underlying issues that maybe haven't been detected, or it has been detected, but not to the extent where we can actually dig in enough to be able to address it. So the numbers are overwhelming, obviously. As you said, COVID has been a factor, except that it is not the cause. Again, people who were already vulnerable, having maybe any other underlying issue, whether depression, dealing with some anxiety disorder or other things, will make these people more vulnerable to deal with COVID. So there's a number of factors combined. We can't really pinpoint on one thing to say this is the reason why. However, though, as I said, as a community, you asked me, the society, there's a lot of work to do in our society, where we still have people who don't associate suicide and substance use disorder with mental health. That's why you see some comments which kind of re-victimizes the victims already. And also the media, I'm actually very happy that you guys are taking on this issue under your helmet, because the media has a lot to do to sensitize and try to fight stigma. So we need to be more aware. We need to create more awareness. We need to raise awareness to the population in general. But at the same time, we have to have a holistic aspect of it, in terms of having all communities working together, whether it's policymakers in mental health and other structures that are involved, whether it's a mental health community in itself, but also the society at large. So we need to create a lot of awareness. We need to really make sure that we take care of ourselves. Education is a key, so everyone is aware. Because within the suicide prevention, there's also some language to look into. You have to make sure that you understand what the person is trying to tell you when they say, I'm tired, I don't want to be here, I want to disappear, I fear nobody loves me, nobody cares about me, I'm not worth it, I'm just... So there are some words that they will verbalize. They will never say that, yes, I think I'm going to die, I think I'm going to kill myself. We don't even use that term. We say someone is... There are language that we have in our industry that we don't really use, some words which may sound like they're re-victimizing the person. So basically, it's being brothers and sisters keepers. As you could tell, the gentleman you mentioned, it has been highlighted that people were struggling with mental health, they have a history. So if someone had a history, sometimes we can prevent it. There are times where we can't, but we do our best to minimize the numbers.
Thank you very much. And I'll come back to you very quickly, Chantal, especially when it comes to talking about the language. I know one of the things that people advise to, especially, and we'll come to also how the media reports on suicide, is that, you don't say someone committed suicide. What's the correct terminology, Chantal?
We don't use that, and we don't say that someone was successful or someone failed. We don't use those words. We just use suicide and suicide attempts. Because actually, there are also stages to get to the actual act of taking someone's life. We start with maybe suicide thoughts, and then someone will have a plan, and then they get to the action, then they do suicide attempt or suicide. So we don't use committing suicide, we don't use failed suicide or successful suicide. So there's a lot of language that we have to be careful about, especially in reporting, people in the media. I'm always calling out people to make sure that they report appropriately. There's a way that things have not been done in a proper way. So we have to look into this issue on a holistic aspect of it, but most importantly that everyone understands that suicide is here. It's not actually mental health in general or mental illnesses. It's here. Sometimes they tell you, oh, it's for white people, you can be strong, we are resilient people. Yes, we have all of that, but at the same time, Rwanda doesn't live in a vacuum, so we are all candidates to have these issues that we see around the globe. Also, what I should say is that we can also recognize some signs of issues someone is struggling with before they even get to that situation. It's okay to seek help, because at the end of the day, someone starts gradually having some kind of emotional pain, and then they don't know how to attend to it, and they start finding ways, and they end up in a dark moment. And there is actually changes in the brain. It's not just someone trying to be bad or to behave differently or whatever. So there's an actual change in the brain. If I can take one example, we have brain chemicals, many of them, but one of it which is involved, not the only one, involved in our pleasure and feeling sad or feeling low mood, it's dopamine. Dopamine is just as simple as just a brain chemical. It's not the only one involved in that process of pleasure. But for example, dopamine, the area which processes pleasure and pain, they cohabitate, they live together. That area in the brain which processes those two things, they are together, they live together. So the dopamine works in a way that it has a baseline. When the brain produces a lot more, when it goes up the line, someone feels happy. When it goes bottom, then you feel sad. So the people who are trying to take their lives, most of the time they are on a lower part of that chemical, and then in the end they get in the dark moment. They have this, what we call thought distortion or dissonance, to the point where they don't see any good thing for them to live for. Absolutely. So it's not something weird to certain people who are weak or whatever, how we interpret it, but everybody is candidate, actually. Like as I said, it's a physical, psychological thing which happens sometimes whether we want it or not. If you don't have good coping skills or support or ask for help, then everybody can be in that black area and can be in that space.
Thank you, Chantal. Dennis, I'd like to go over to you and also hear, your perspective on suicide prevention and awareness. And, you've been working for the last 3 years with Teen Challenge Rwanda. So if you could share with us, what's your perspective on suicide prevention and awareness? What more can we be doing as a society to highlight these issues, especially when it comes to this becoming sort of a, almost prevalent thing amongst young people?
Well, thank you very much. I'm so grateful for already this opportunity that you've given us to highlight these issues and giving it the attention that it so much deserves. Most of the things have been highlighted by my colleague here. I call her a colleague because myself, I'm an occupational therapist by profession. So I have an informed opinion, maybe. She has said much about it. One good thing about our nation is that we already have a good structure in place. The health ministry, you know, from the community health worker to the health centers, to the district and district referrals. So I think what the society needs to do is to tap into this structure that is already in place. Most of the mental health care practitioners are at the district level. For someone to be referred there, they are already manifesting these signs. So prevention is better than cure. I think the society should empower these community health workers to be able to identify people that are at risk, people that are having mental health issues, like she talked about, being able to identify those symptoms before it progresses. So that's one thing. Another thing is to do with stigma. You know, something, when people see you going to Ndera or some other places, they already put you in a certain category. So that one is crazy. He's mad. And they give it a negative connotation. And yet these are conditions that are manageable. So if we would sensitize people well enough, they would be able to be bold and to seek help. Yeah, thank you.
Thank you very much, Dennis. I'd like to now hear from the rest and panelists. My first question is to you, Berna. In addition to what I'm sure you're going to say based on what our guests have shared, I just want your take as a media practitioner, as a journalist, and I know you've mentioned this a couple of times before, the way we report on mental health in this country, the way we report on cases of suicide. I know Rwanda Media Council recently put out a communique saying, you know, more or less teaching our media practitioners how to better report on issues to do with mental health. What's your take on this?
First of all, I thought the communique from the Rwanda Media Council was reactionary more than anything, because we don't even have experts as such, so you cannot expect media to be experts on the subject. So for me, I would have expected the Rwanda Media Commission to issue a statement saying, we know there's an issue and we're going to train you. Build capacity and then follow with policy. I don't think policy should come ahead of capacity building. That's one. Two, I think we have to give credit to the journalists who are trying to report these cases, because, of course, most of them are learning on the job, and for many of them, the stories they did perhaps 2 years ago are not the kind of stories that they're doing today. So, for me, I'm grateful for everybody in the media that is highlighting these issues. And then, of course, we move towards perfection. How do we tell these stories better and put a human face to it? It will take more than regulation, because in most journalism schools, I must say the less attention is on training journalists to approach issues as human beings. If to be honest, the training is you should distance yourself as much as you can from whatever you're reporting about. Now, what we're seeing is a challenge, questioning whether the journalism theories are still relevant today, because one, we have to report with empathy. We have to recognize the importance of being human beings first and treating, the other person as a human being first before anything else, not just as a subject. And I think journalists share that with with doctors. Sometimes doctors just look at as a subject, you know. Yeah, so it is work in progress as far as the media is concerned. But for me, I'm really grateful for all the journalists that are attempting to do more of these stories. The local reporters especially, we've seen a lot of reporting from the New Times. My wonderful friend Nash, I'm very proud of you. So it's good that we have more of these stories. Secondly, I think it's a challenge, again, for our community because of the nurturing. Most of the time when you start complaining about issues, the response is, why are you weak? You know, why are you weak? And if you're a man, it's even worse because the society will tell you, you are a man, you can't afford to be vulnerable.
Man up.
You know,
Exactly.
yeah.
Exactly.
You know, you have to man up. And so that has to change. And it's not something that comes easily until we have several campaigns to demystify what it is and for people to be allowed to be vulnerable and for us to take time and not be quick to judge. Because at some point we are all vulnerable at some, you know, and perhaps the difference is whether we show that we are vulnerable or we are able to conceal it. So if you ask me, I feel the discussion going forward has to be, and the campaign that has to happen, first of all, is the change in terms of how we perceive mental health issues. Secondly, we have to, because they talked about capacity building for community health workers to be able to identify some of these cases and see how they recommend at the national level. I think that is even more difficult because most of the time, again, because of what we're used to, people will go to a healthcare center because they have malaria or, you know, not because someone maybe feels worthless, exactly. You know, yeah. So it's delicate, it's not easy. I don't think that it can change overnight, but if we take deliberate steps and work towards one, acceptance that life is not perfect, it is not perfect anywhere, and being vulnerable is okay. You know, even men cry, it is okay to cry, and men are not necessarily, and they are not God to have solutions.
I know. I think at the end of the day, you know, what I'm picking from what you said and what Chantal said and what Dennis said, in everything that we're trying to do to deal with this issue, we have to be deliberate. Whether it's destigmatizing it, whether it is ensuring it's embedded in our healthcare systems, whether it's, you know, societal change in mindset, it has to start from a deliberate point. Charles, over to you. I liked your comment when Brian was talking about men can be vulnerable, and exactly that phrase "man up" is very common.
I sort of want to take it from the jobs that Dennis and Chantal do and sort of link to what Bernard talked about earlier on around everyone is vulnerable. And I think in their day-to-day jobs, Dennis and Chantal and everyone else who's in that space, is about demystifying mental health and for all of us to understand that anyone can have a mental breakdown.
Exactly.
It's just the intensity that will vary, and the way you handle it, or probably the way you man up, or maybe your circumstances might be very different. And I'll give two examples of a workplace and a home setting. So post-COVID, if at your workplace your sales have gone down, your business performance has dipped significantly, and the owners of the business or whoever or the marketplace is expecting more of you yet necessarily the market is not adjusting that way. You know, your boss expects you to drive traffic to your hotel, yet there are lockdowns, yet, you know, and then if at the end of the month you're not able to, your boss cannot afford to pay your salary because you only had 2 guests in the hotel the whole month, and therefore it becomes your problem. You as somebody who's supposed to drive business into the business, you can imagine how much stress that is going to have on you. And then you get that pressure. You go back home and you find that you can no longer afford meat 3 times a week, and even once a week it's a bit of a problem. And then that builds up. So how then are you extremely deliberate about it, as you said, Dan, earlier on, that the people who are in that space, I think Dennis called it occupational therapy, if that's the word, yeah, that we all understand it, that it can happen to all of us and anybody, irrespective of COVID or COVID not. You know, story is told of one of our very senior servants, civil servants, who the job changed. And he was posted elsewhere out of Rwanda and in unknown waters. He didn't perform as well as he was expected to perform, came back home and struggled to fit into society. You know, it's and the Rwandan society can be a little bit harsh. If things changed for you as a senior civil servant, even your nephew stops taking your calls. Yeah. So those kind of things build up, and then all of a sudden you see this person who has been in the media all the time, and we're all looking forward to him. He's speaking at that event, speaking at the other event. He's a disgrace. So I think the point really is that we all need to be prepared that anyone can break down at any point. It's just the intensity that
absolutely.
Yeah.
And I think the issue is when they do, you know, what systems are in place on a countrywide level to help these people who are going through this. I just want us to read quickly through a tweet, just to put this in the middle of the convo, not at the end, because there's so many coming in. I think this is an issue that touches on quite many people. So the first tweet coming in is from Frank, who's a regular tweep, is that what they call it? Of the Square, Twitter, a tweep. And he says that we need a mental health legislation which will establish robust safeguards and oversight mechanisms to protect rights, dignity, and autonomy of people living with a mental illness. Chantal and Dennis, I'll come to you on what Frank has said later, but we'll go to our next tweet that's coming in from Tuisenye, and he says that mental health issues are very crucial. Unfortunately, some people don't consider this as a priority. Government and stakeholders should put in place a mechanism to treat mental health issues at the lowest level. Suicide might be a result of mental health issues. Yes, absolutely. I think Tuising has a very strong point. We have another tweet coming in from Alice, and Alice says that, dear Nisa123, that's Chantal, I know how knowledgeable and passionate you are about mental health. Keep up the good work. Very proud of you and bon courage. We all ought to continue speaking up for all our people suffering from psychiatric disabilities back home. We have several tweets coming in. The other one is from Dolapo, and Dolapo, we can have that tweet on our screens. Dolapo states that interesting discourse. With the figures reeled out by the host at the beginning of the show, what do the specialists think are the root causes of the high rate of mental health related issues? Media journalists ought to use the emotional quotient, the EQ, in reporting health issues. And I think Dolapo echoes what you're saying, Brenna, but it's now a tricky balance, you know. I'd like to just take it back to our guests very quickly, so they can answer some of these tweets, as well as also just talking on what Charles and Brenna have said, in case they have any points to add before we go to our next topic, which is on addiction. But allow me to read the numbers. I think earlier on I had said the numbers were between June 2019 to June 2020. The cases in terms of suicide reported by Rwanda Investigative Bureau were from July 2019 to all the way to, if I'm not mistaken, June 2021. So this is over 2 years, 576 cases. I would like to just head over back to you, Chantal and Dennis. Dennis, I'll kick off with you. If there's something you want to respond to the tweet or respond to what Charles and Brenda have just shared.
Well, thank you very much. I can begin with your figures. Actually, for every attempt that's completed, just know that there are other 20 people that have contemplated that.
Wow.
So for every completed suicide, there are 20 others that are thinking about it. So you can multiply that 500 and something by 20 and see the magnitude of the problem that we have at hand. And those are reported cases. So with this, you are asking what really causes this. And I think Chantal will get to it. In regards to substance abuse, I don't know if I'm jumping the gun or you're already there, but they go hand in hand. They go hand in hand. You know, it may begin from that depressive episode that you're broke and you need a quick fix. Then you start with a beer. Soon the beer is not enough. And you know, you started from having other issues and you end up abusing. You end up addicted. Or in my case, I started from drugs and alcohol. And then I ended up with mental health issues. So it's what I think they call dual diagnosis or comorbidity, meaning that you can start at one end and lead to another. Yep. Maybe if you can remind me of the question.
Yeah, no, I think you answered it when you talked about, what are the causes. There are many causes, and I really liked how you I really like how you spoke that for every completed suicide, there are 20 other people or other individuals contemplating this. That's just very staggering figures you gave there, and it's very sobering in terms of thought. But Dennis, with your personal story, I didn't want you to touch on it just yet because I want to give you some more time to touch on it when we get to the topic specifically of substance abuse. So just hold it there for a few minutes. Chantal, if you wanted to quickly respond to some of the tweets that were put forward before we go to the next topic.
Thank you, Diana. Someone mentioned about having the services on the grassroots, and I think Dennis has also alluded to it, saying that the community health workers, yes. I'm happy to say that actually the service exists. We have clinical psychologists to almost all the health care centers. What I am understanding is that actually they are underutilized because, as we were saying, the knowledge, the awareness isn't there, and the referrals are not coming out. So I think we need to do more sensitization and more mobilization. Also, Dennis was actually, I think was Charles who mentioned it, saying that. As we said, everyone is a candidate, and saying someone who is collapsing from being somebody to nobody, and then it creates some kind of mental health issues. We see both. We see that impulsivity which happens when someone has lost something significant, someone, a loved person who departs, and then they feel they can no longer live without them. We see people collapsing, whether it's financially, whether it's a status level, and they feel that they can no longer live without what they have been identifying with, and then they try to take their lives. But also we see a long-term progressive coming to starting from just a simple condition, and then it continues to get worse and worse, which leads me to mention this, that ignoring mental health doesn't make it go away. If you are suffering, you are emotionally in pain, you don't need just to ignore it thinking that's going to go away, or people use prayers. I do respect prayers. I'm a Christian myself. However, though, we are talking about science. If someone has diabetes, you will pray for them, but also you will encourage them to go see a doctor and get some medication to regulate their glucose. Same thing. If you ignore mental health, in the long run, it's going to get worse and worse, and then you can end up, from what we were talking about, paranoia, psychosis, crisis, and even suicide attempts. So it comes gradually, whether it's substance use or suicide. And we see people changing. We see them in behaviors. We see changes in withdrawing. There used to be social butterfly, people who are out there trying to help, and then all of a sudden they withdraw. We see people becoming different, not taking care of themselves, starting to miss out jobs, or their performance gets reduced, their concentration gets reduced. We see those symptoms coming, but maybe we don't put things together again, lack of awareness.
Thank you very much, Chantal. We'll definitely touch more on that, but I think you've given us really a broad spectrum of the different elements of this issue when it comes to suicide prevention and building awareness, and looking for the signs. So trying to really be empathetic as well when we see people changing, and everything that you have mentioned. We'll definitely link back to that. I just want us to go to the second part of the conversation, which is to do with substance abuse. Like Dennis said before, and you said before, there's a linkage to these issues. And if you'll just allow me to read some numbers before we kick off on this topic. The United Nations 2019 World Drug Report stated that 35 million people suffer from drug use disorders worldwide, with smoking, alcohol, and illicit drugs collectively responsible for 11.8 million deaths each year. And here back home, the government of Rwanda spends between 70 to 80 million Rwandan francs per month in rehabilitating people at the Iwawa Center. I think we all know the Iwawa Center, which is one of the largest 3 rehabilitation centers run by the National Rehabilitation Service. Again, these numbers are sobering. I just want us to now focus on the issue with substance abuse. And I'll start with you, Dennis. If you could share with us your personal journey. You have a very compelling testimonial that I hope will inspire others, but also whoever is listening, going through whatever they're going through, to connect. And through your journey, you now committed to working with youth through Teen Challenge Rwanda over the last 3 years, who are going through issues to do with substance abuse and and mental health issues. If you could just kindly kick off this part of the conversation, with your story, Dennis.
Well, thank you very much. As we said, that no one is safe from these issues, be it addiction, be it mental health issues, and I've been there. I've played there and got the T-shirt, as they say. But I thank God for making it through. Mine is it's a long story, but as I said, I'm an occupational therapist, so I'm supposed to be knowing these things better, and I'm supposed to be helping. But at a certain point in time, I fell victim to this scourge. Or I call it a weapon of mass destruction, because the number, it does not segregate whether you're educated, whether you're rich, whether you're poor, whether you're upscale or lower scale. It's all. So for me, I started with early age drinking, but I neglected it. So one wrong choice after another wrong choice after another wrong choice. I kept graduating from alcohol to other substances. And I managed, luckily, to complete my education. I got a job. I first worked at King Faisal in the occupational therapy department. It was around 2011. But my condition was worsening. So I would come under the influence, come to work under the influence. I would just leave without asking permission. I go like for a week, they don't know where I am. I actually left without saying bye. So maybe I felt that the pressure of the city was too much, and I went to Kayonza, and I was working with Gahin Hospital for about 2 years. Again, because I was just trying to treat the symptom, it kept growing. So while at Gahin Hospital, I would come over the weekend to town here, then I go back like on Sunday evening or Monday morning. That's when it really came to light that I have a serious issue. One time I blacked out in the taxi park of Kayonza. I had spent like 2 days without sleeping. And then I fall down, they check my pockets, and they find that I'm actually an employee of the hospital. So they took me when I was unconscious and took me to the emergency ward. And that was the first time of the many episodes there. It was around 2 p.m. and I regained consciousness like around 3 a.m. in the morning. However, I'd lost my mind, so to say. I could no longer recognize people. They had called some people at home to come and check on me, and I couldn't tell my own family members. So I was referred. They referred me to Ndera Hospital. I was hallucinating, seeing things, hearing voices, and at Ndera I was referred to their. They have another center that is more specialized with addiction issues, and in Chizere, I think many people are well conversant with it. So I went there for a month, but I was still underestimating my condition. So I left after 1 month thinking I would conquer this. I had it within my power to change, but I later noticed that it was beyond willpower. It was beyond the wish to change, or the independent will of man. So I decided maybe, okay, I've been going to bars in openly, I'll be drinking from my place where I was renting. And it was just a matter of time. They looked for me, they couldn't see me, came, found me, they forcefully opened where I was sleeping, and they found me had passed out on the floor. And again, back to the emergency ward. It's not that they put up with all this because they knew I was competent at work, but they could see I have a serious issue. So they recommended, they gave me an indefinite suspension and told me, no, you go and first seek help. Go and first work on yourself. We know you're brilliant, sharp, you know what you're doing, but there's something that you need to work upon. So from that emergency, I went back to Chizere. Then after that, I was still in denial. I didn't know that I have a problem. Then to cut the long story short, I went for further studies. I decided to do medicine because I was feeling now these head of departments, they are hard on me because they have more books. So like, let me go back to school. Then when I come back, we shall be at par. Then we shall speak as colleagues. But it didn't go like that. Medicine is such a tasking course, and it needs a sober mind. So I just managed 1 year. The second year, after the first semester, I was out. And at home, people begin by helping you, wanting to help you, but as you progress, they also give up. They are like, we've tried all means, we have given you, there's nothing you have lacked. So, okay, that's your choice. You take your route. There is food here. You won't starve. You go do your things. Come and eat. And having failed, I hit rock bottom, so to say. What I feared had come upon me. Eventually, it had caught up with me. And one thing other than poverty, as Charles alluded to, is, and it's what many boys that I deal with that are facing, is having that frustrated potential in them. You have a lot in you, but you don't see how to put it out there. And you're looking for an outlet. You're well educated, you have no job, you have nothing, but you feel this potential that is untapped, that is not going out. So that really killed me, and I decided to give myself wholly. Of course, I couldn't deal without drugs. So eventually I had episodes of drug-induced psychosis or mental breakdowns simply because of drugs. And I was having depression, I was on antidepressants, I was on antipsychotics for some time, not for long, because when I was off drugs, I was okay. So they kept tapering down the dosages. So until I like the medical model. I will tell you about what I do. I work with a faith-based rehabilitation organization. I'm indebted to the medical model. Maybe if they hadn't helped me, I wouldn't have lived to get saved or get born again. But I lacked a foundation onto which to lay these brilliant principles of behavioral therapies, of cognitive behavioral therapies, of psychotherapies. I felt like they were built on a shaky ground. So one time I just decided I had nothing. So I turned to God, I prayed, and I looked up like Nebuchadnezzar and said, my pride has caught up with me. I can no longer do this on my own. I know, so if you really can come to my rescue, please do. And that was in 2015, yeah. And my majority of my family had given up on me. And after that prayer, after a few days, one of my uncles called me and he asked me, so what's up, what's happening, what's taking place? And I told him, we used to live together before shortly, and he had warned me, he told me, that path you're taking is not a good path. You're going to be funny. You're going to lack. So he spoke many things, and I told him, whatever. I have my life, live your life. So when he called me, I told him whatever he said came to pass. He's like, what can we do? I told him, give me another chance. He's like, okay, you come and we plan. So I came, and he asked me, what can you do? I told him, I have a lot of noise in my head. I need somewhere quiet. You've been taking me to Chizere by force, but I really want to go there and request to be admitted once again. So we went this time on my own accord, my own volition, and I sat there and I did some serious soul searching, and I noticed that the best counsel or the best wisdom that I could ever get was my own counsel, that I would sit and re-examine my heart or my mind. So after leaving that place, I noticed that the urges were not that strong. So later on, I didn't go back to seek for gainful employment in the hospital. I just decided to share my testimonies, and I landed Teen Challenge because I had a burden for these people, and that's how I ended up from testimony to volunteering to being a staff member, just a staff member. Now I'm the director of program. So that's my journey in brief.
Thank you. Thank you very much, Paul. I really wish we could have this show for 3 hours, if possible, or just another hour. Unfortunately, we have to respect time. But your story is extremely compelling. I think one thing I pick up is that it's never too late. It's really never too late, and that it also has to be of your own volition. We have relatives, we have friends who are going through these things, but you can't drag them to seek help. You can't just take someone and dump them at a therapy center or a rehabilitation center unless it doesn't come from their own. I want to read a couple of tweets very quickly from our viewers before we go to the closing remarks. And the closing remarks, really, it's a call for action. If you were to give a call for action to communities, to families, to stakeholders in government, to players in private sector, what would it be? Hold on to that call for action very briefly. Chantal and Dennis. If we can just quickly read some of the tweets coming in. The first tweet is from Nasra. If you could please have that on the screen, who says that COVID-19 has taught us that that with the right information, Rwandans are willing to listen and learn. We should invest resources into educating society because they're not aware that good mental health is basically the launchpad of everything else. That's a tweet from Nashra. We have one tweet coming from Uwase, and Uwase states that myth, anyone who tries to kill themselves must be crazy. Fact, most suicidal people are not psychotic or insane. They are upset, grief-stricken, depressed, or despairing. But extreme distress and emotional pain are not necessarily signs of mental illness. Very interesting tweet there from Uwase. We have another tweet. We'll be reading anyway some of the tweets coming in later. But before we go to the last call, I just want very briefly to hear from Charles and Brenna on what's the very powerful, inspiring, compelling testimony that Dennis has shared with us. If you'd like to share your thoughts on that, or also just general thoughts on the topic at hand tonight.
Dennis says something that I've always had a problem with, and that is Iwawa as a center itself. I have friends, relatives who have gone to Iwawa and not come back any better people. And that's because I think when you bundle up somebody of Dennis's caliber who's got a different challenge from a street child who's a street kid who is sniffing glue all the time, and you put them in one basket, you're most likely not going to help. And apologies, Dennis, for giving you as an example. You probably will not help Dennis's cause. And I think that's one of the biggest problems I've had with Iwawa and the approach that's been there.
Can you just reiterate that? The biggest problem?
Yes, is that they tend to bundle up people with different challenges into one place.
Okay.
And my friends and relatives who've been through there, including one of them who was not able to make it back. Chantal warned us not to use certain words. It's painful. That and I hope lessons have been learnt in the way that particular center is managed, that people do not necessarily have to be bundled up. I have a friend who's a bit senior in our government who has a problematic nephew, and he says there's no solution for this guy apart from sending him to Iwawa. And I always argue with him that you are to do what? You'll just worsen his situation. So that's on one side. The other thing is really society to accept that some of these problems are not Bazungu problems. Earlier on, Chantal talked about anxiety. Try and find a Kinyarwanda equivalent for the word anxiety. You will struggle to find it. Yes. So true. It's very easy for you for us to sit down and say, anxiety is a Muzungu problem. How are you anxious?
Yes.
I mean, how is that a problem in our context? Or to say that somebody is stressed. Yeah, stressed to the extent that you're not performing at work, and then it will lead to other things, and so on and so forth. So some of these things, it requires society to be educated so much that these are not Bazungu things, and it really starts with us.
Thank you, Charles. Yeah. Brenna, very quickly before we give closing remarks to our guests.
Just to thank Dennis for sharing his story with us. And we need to have more safe spaces for people to share their stories. And until we start talking about things and taking away the stigma around these issues, because currently there's a lot of stigma, and that is a big problem because people do not seek help. And where there's a problem, people try to conceal it. They don't seek help. So we really have to address the stigma. And part of addressing the stigma is creating safe spaces for people to actually express themselves and be vulnerable. Yes, and be vulnerable. Finally, I think the government has had many campaigns. I think it's high time that we also had one and annual campaign around mental health. Just 1 hour is not sufficient for us to tackle the issue.
I totally hear you. Absolutely hear you, Brenna. Charles, your point on just, not understanding the issues with mental health and just bundling it up and, putting, very different people with different needs in one place. Sometimes it exacerbates the issue. It's absolutely something we should consider. I want to read one tweet before I go to our guests, and it's an appreciation tweet, more or less, if you could have that on our screens. And this tweet is from Agatha, if you could have that on our screens. And Agatha states that important conversation. Thank you, The Square, for bringing this up. A big thank you to Dennis for your boldness to share your redemptive story. Mental health illness is real, addictions are real, COVID-19 made it worse. Agaba Bruno has summed it up. Thank you, Bruno. If you could just go closing remarks, briefly as you can, a call to action to stakeholders in government, private sector players, communities, families. Chantal, I'll start with you. When it comes to mental health, what would your call for action be?
Call of action, I will put it in 3 levels. As a society, we have a responsibility, and the 3 levels I will say is from the decision makers, mental health community, and the society at large. From the decision makers, I think policy-wise we have gone that far, but we still have a long way to go. Especially, I would like to see mental health becoming part of primary healthcare system. When someone goes to do prenatal checkup or even vaccination for a baby, they can have maybe a screening of depression or something, or ask them if they sleep well. Just do a quick screen on mental health. The community health, the mental health community, we need to be more present in the community. We need to have more presence in the community and raise that awareness, and also try to help when we're needed. And society at large, we need to be aware of mental health. We see on the villages people who have psychosis, what we call crazy people. They're naked, they're roaming in the village, and the kids are running after them, and nobody cares.
Chantal, sorry, I'll have to cut you short in the
yes,
time, but
I was done.
Yes, we get
Thank
it.
you.
The 3 levels. Thank you. Dennis, briefly, closing remarks, over to you. As brief as possible.
Thank you. For that person who has not yet started, please don't, because it's not bad for your mind, the way you take care of your body, please take care of your mind, because it's the only one you got. There's no transplant for that. And for the families and parents, I say that please don't hide those cases. Most people don't want to they think it is something shameful before their colleagues. So seek help for your loved ones. Yeah.
Thank you very much, Dennis. Thank you very much. Unfortunately, this is a conversation that we cannot, fit into an hour. Like I said earlier on when the show began, this is the 6th edition. We'll definitely have many editions. Chantal and Dennis, thank you very, very, very much. I'd like to thank you for coming onto the show.
It's a pleasure.
Thank you very much. Charles Bena, great to have you on the show. To our viewers, thank you for tuning in. Keep the convo going using #TheSquareRW. Our partners, Uzi Collections and Bourbon Coffee, thank you for supporting The Square. Have a good night. Mental health is real. Mental health is important in Rwanda. Let's keep the conversation going nationwide. Thank you. Have a good night. See you again next week.